Never leave room for my paper.
Yeah.
6 feet in between everyone.
That's right.
We all set? Good afternoon. You guys all set? Okay. So this afternoon, our health department was notified of an adult and New Haven resident suspected of having COVID-19. Because the adult has had limited contact with Nathan Hale School and a student under their care has been attending the school, we have decided in collaboration with the superintendent of schools to close Nathan Hale down for 2 days to clean the school. The individual suspected of having COVID-19 had recently traveled to New York City and has symptoms consistent with COVID-19. Influenza has been ruled out. The New Haven Health Department is in contact with the family and has asked them to self-isolate, which they have agreed to do. At the moment, only one family member is symptomatic. At this point, we believe there is low risk to any other students, teachers, or family, and we are not recommending that any other Nathan Hale students or families self-isolate. The school will be closed through the weekend, and we will be making a determination later on when we will reopen the school. New Haven Public Schools sent out a robocall to parents of the school and caregivers, and approximately an hour ago, they received that robocall notifying them of the situation. Since we now have our first suspected case of COVID-19, we have opened the Emergency Operations Center to actively monitor this case and any other cases that may arise. It's very important for the community to understand that we are all responsible for reducing the likelihood of the spread of the disease. And that means that we all need to be cautious to use personal hygiene, washing our hands for 20 seconds thoroughly, not shaking hands with other people, not touching our face, reducing the times that we go to large gatherings, avoiding large gatherings if possible. If you do have flu-like symptoms, please do not physically go to the hospital or your healthcare provider. First call and have that individual talk you through your situation so you don't potentially contaminate other people. We are all working together to address this challenge, and we can only successfully address it as a community. And so we're looking for the cooperation of many people in our community to do so. I don't know if anyone else wants to add something or if we just want to open it up to questions. Do you want to add something, Dr. Tracy?
Let me add, I'm Eileen Tracy, Interim Superintendent, New Haven Public Schools. I know that there is some thinking around what we're doing. We have been in preparedness state for the past couple of weeks and even planning educational plans for our students. So I'm sure Nathan Hale is already prepared to make sure that there's educational continuity, even with the 2 days or for however long it takes. So we are very responsive to the needs of parents. If there are things around health issues that parents have concerns about, we've decided with Dr. Bond, the health director, that they will call her around those things. If there are educational concerns, they will call our school system and get the necessary information that they need.
Now, you said the adult came into limited contact with the school. What does that mean, and what is their role?
Do you want to address this?
Sure. So when the call came in, as many other routine calls come in with concerns, as you know, we are actively assessing every situation that comes in through our on-call system. The individual was coming just in and out to do pickup and drop-offs, and also engaging in some after-school activities as a guardian. And so they were not there for a long duration period of time. However, they were there, in and out about approximately 5 to 10 minutes. And so we want to just ensure that we take the proper precautions in disinfecting the school, doing a nice thorough cleanup of the schools just as a precaution. And so I just want to reiterate, as the mayor indicated, is really important as we are continuing to monitor this outbreak. As you know, is officially a pandemic. Every day the numbers are changing. We are asking individuals to really practice social distancing, to also stay home if they're sick, to understand their risk, their symptoms that they are experiencing, and to contact their healthcare provider first and foremost, and then get directions from there.
We know he or she was in contact with one student. Does that, do you know if the student has siblings that came in contact with this person as well?
There are no other, right now we're doing contact investigations, so we will be interviewing, doing some further interviews to really assess any other contact. Currently, there was minimal contact.
And the student is being tested?
The student is asymptomatic, the student is not presenting any symptoms.
And could you repeat how exactly the city found out that this adult likely has COVID-19? Did that adult call the city health department?
So ever since we activated our hotline, we have been getting phone calls from many individuals. The person did self-identify with the school. The school immediately contacted us as we're collaborating together on this matter. And so we've then received the contact information and began the investigative interview.
The mayor mentioned that the school will be closed for at least 2 days for cleaning. Could you talk a bit about what that cleaning will entail? What is it that will be happening at Nathan?
That's the facilities question.
2 days.
So our custodial department is activated through Mr. Pinto, who is the COO, who is in charge of the custodial services. Deep cleaning, whatever disinfecting needs to be done, cleaning down everything possible that within their control they can clean down to make sure that we can declare the area somewhat sanitized.
Will it be focused in any particular area of the school?
No, the entire school, since we don't have all that information yet, is still under investigation. But we're just being taking precaution.
I know there will be classes tomorrow and Friday, but then for the weekend, I know the students will be there, but then there'll also be people in the building cleaning then as well. Or is this going to go, can we say for 4 days or is it just 2?
It might just be on that.
Mr. Pinto.
Good afternoon. So right now we were actually in the process of sealing the building, or not sealing the building, but we're locking the building. Everyone's gone home. We are not doing our normal custodial routine for the evening. We will return because we want to give any potential contagion and some 24, 36 hours to reduce its virulence to whatever level possible. We will go in and do the deep clean and disinfecting beginning on Friday. We'll be in on Friday and then on Saturday, and then obviously we'll simply not seal the building, but lock the building, no one in or out on Sunday, and then reevaluate for Monday morning.
Do we know when this guardian went to New York, and do we believe that this guardian got this during that visit?
So we have the details of when the individual traveled to New York. We also understand the method of transportation utilized for this individual. And as you know, we have over 39 states currently that have positive cases. And so it's really important as we are, this is progressing and every day evolving, that individuals really take proactive measures on really making decisions that, though we were talking about international states earlier on in the weeks, we're now asking people to really just be monitoring the CDC website on positive cases in other states. Surrounding states around us, the state of New York has declared a state of emergency, Rhode Island, Massachusetts, so every single state surrounding us have declared a state of emergency, including Connecticut. And so as people are planning and doing their day-to-day activities, it's really critical that people start really thinking about social distancing, and then also doing just basic pre-planning, preparedness planning for their homes in the event that they do have to self-isolate as this progresses.
Maybe a better question would be like, how long do you think this person was potentially infectious before realizing it?
The person was asymptomatic for several days. It was 4 to 5 days later that the person began feeling flu-like symptoms, and then contacted their healthcare provider with the concerns. The individual was then tested for influenza, came back negative, also had an X-ray done, also came back negative of influenza. And so given the circumstances, we want to ensure that the person is self-quarantined for the next 14 days. And we will be monitoring that individual daily, and should any of the symptoms get severe, that person will then be instructed to follow further instructions.
Are there any plans to
We are interviewing the person extensively to identify other sources where the individual may have spent time. Right now, we want to safeguard and ensure that the school is a factor that's going to be first cleaned. Again, it's a low risk factor, as the mayor indicated, but we just want to take the proper precaution, and we'll be finishing our contact interview with the individual.
Do we know if this caretaker has any pre-existing health conditions or any issues at all?
We cannot disclose any medical conditions of the individual.
Are there any other schools that right now you all are planning on closing for COVID-19 related reasons?
Currently, we do not have that. Of course, things are evolving every minute, so we currently are focused on Nathan Hale School at the moment.
And this may be an obvious question, but why did you all decide that closing the school for 2 days was the best response, considering the level of potential exposure? Why?
It was a collective decision to ensure that we have the proper time and staffing to provide the entire school to be clean. So we wanted to just make a collective decision on 48 hours of getting through the entire school.
Can I just add something? I think it's important. So just an answer to that question, it makes it a little bit easier for us to decide 2, not 3, because the weekend is there, and it gives us more flexibility to have more time to clean the school should we need it over the weekend. And also it gives us a little bit more time to understand the contact history of the individual and whether this is, you know, if there's other angles to this that we haven't foreseen. I do think it's really important to underscore that through our conversations with the State Department of Health and our internal conversations, we believe that even though this one adult is suspected to have COVID-19, that the risk to students at Nathan Hale School is low, and that we are closing the school because we want to be very cautious and make absolutely sure that we're not increasing any risk to individuals. So this is because we're being cautious. We're not doing this because we're very, very concerned that there's some potential issue or that students have been exposed to anything. But we want to make sure that we do the right thing. Any other questions? Okay, thanks.
Thank you.